Hello everyone, I'm Dr. Karishma Kagod, board certified plastic surgeon at Dr. Karishma Aesthetics in Bangalore, and today I'm going to discuss with you what are your treatment options to treat gynecomastia or male boobs and what is the recovery looking like. So when we look at the treatment options and say we see a patient in their puberty age group, young 16-17 years, and we have diagnosed them to have a male breast enlargement and gynecomastia, it is important at that point to do a little bit of monitoring and we do a watchful waiting. We need to rule out if the boy has any internal medical issues and try to treat it. Now there are a few medicines in the early stages like tamoxifen and certain endocrine medications which can treat any hormonal conditions if you have. Now, if those internal hormonal conditions are treated at a younger age, you may see within 1 to 2 years, this abnormal gland enlargement may be corrected and the gland will slowly shrink in size. So, if you are facing this issue or your child is facing this issue at a young age between 16 to 19, I would suggest first get an opinion from the plastic surgeon. We will help you understand, maybe start you on early steps of medications, and in case your child is also a little on the higher BMI, I suggest that he should be put on an exercise routine, on a lifestyle, on a good diet to help him lose all the baby fat in the body. And when the baby fat is lost, you will also see that the internal hormonal correction happens and this gland tissue starts to shrink in size. Now, if this problem is still persisting beyond 1 to 2 years of the medical treatment, then we have to go for the surgical option. So gynecomastia can also be graded from grade 1 to grade 4. In grade 1 and grade 2, there is a mild to moderate gland enlargement, but there is no extra skin and the chest is not sagging. In these scenarios, I only perform a liposuction, remove the fat as well as gland tissue. In those who have grade 3 to grade 4 gland enlargement along with sagging skin of the chest, we need to remove the gland, do a liposuction, and if the skin is sagging too much, like in a feminine appearance, then I also will have to do a little bit of skin removal around the chest in order to tighten the chest skin along with just removing the gland. So as far as possible, I wait for my patients till the age of at least 18 to do the surgery to remove the enlarged gland. However, there are a few boys who I have encountered who come at 16 to 17 years who are extremely psychologically distressed, are possibly already seeing a psychologist and a counselor because of this chest issue, and sometimes we have to undertake the surgery even at the age of 16 to 17 with a guidance from the psychologist and a medical legal certificate asking us, because the boy is under the legal age of 18. Now once you have crossed 18, most of your body development is 100% in case of boys, and yes, we can take the surgery. For a gynecomastia problem, surgery will be your final only solution in order to treat this condition. So there are two important steps of this surgery. Number one is liposuction. I will perform a liposuction to take off the surrounding fat which is present in the chest in most case scenarios, but at the same time we also have to break the gland which is present underneath the nipple. So today's day we have 3rd generation and 4th generation liposuction devices like the power liposuction, the laser liposuction, high frequency ultrasound based devices which also has heat, and due to these latest generation devices we can very easily break the fat as well as the abnormal gland underneath the male chest region. So in my practice, I usually first perform a liposuction. So we make a small keyhole incision through the armpit and we remove uniformly all the fat which is present in the chest region and also on the side of the chest wall. Now after liposuction, next most important step is the gland excision or surgical gland removal. Now we can do this gland removal through liposuction alone, but in some scenarios where the gland is very big, very heavy, and very large and hard in texture. Liposuction may not be enough to take it out through the tiny keyhole incision. In that case, we make a small 1 to 2 centimeter cut at the bottom area of the areola, and through this 1 centimeter cut, we take out the leftover gland which is present behind the nipple, causing the prominence. Well, I'm sure many of you could be hesitant about undergoing surgery for gynecomastia, and as I say, I keep repeating, surgery is sometimes the only option in the end, even from celebrities like Dwayne Johnson. As a WWE wrestler, before he even got into wrestling, he suffered from the same gynecomastia issue, and if you watch one of my YouTube videos, you will see the problem that he suffered for and finally had to undergo this surgery. The surgery may seem dangerous for you, and many of you may have some sort of fear. So just to alleviate these fears, let me tell you, this surgery is one of the very short cosmetic surgeries that we have today. It's 45 minutes to a 1-hour procedure. It is a daycare surgery. You come in the morning and you can go home the same day evening after the procedure. You will have extremely tiny and negligible scars, and the wounds are so minimal that they heal within a week. In case of a liposuction, you have a small keyhole incision in the armpit. This heals within 4 to 5 days. You will just be putting a little ointment and a small dressing in the area. In case of a very large gland, and in those scenarios where there is a lot of hanging skin in the chest and we have also removed extra skin, you may have a tiny cut around the areola. For the gland removal, this cut also takes about a week to 10 days. There are a few stitches which will be placed, but those are inside the skin. Nothing will be visible from the outside, and most of the scars of gynecomastia are almost negligible within a few months. You don't have to worry about the healing issue. We guide you through how the dressing has to be done and how you need to take care of the wound, but within a week, all the wounds of a gynecomastia are completely healed out. After the surgery, what I do is I put certain tight bandages on the chest so that the skin will tighten up onto the chest, and with the bandages we also make you wear a compression waistcoat. Now this compression waistcoat has to be worn for possibly 2 months at least, along with the waistband. The first 2 days you will have a tight dressing over the chest, and by the 3rd day we will remove these dressings and you will see how the new shape of your chest is. You can go back to your daily home routine activities by day 3, day 4. You can get back to your office routine by day 5 to day 6. In fact, I operate on a lot of bodybuilders and trainers who need to go to the gym and probably train other clients. And by day 3, they are back to training their clients and back to work. So it's a very simple procedure, which is daycare. You recover very soon. You are just wearing a compression garment. And if you are going to the office and you are hesitant about the pain, then I suggest you take a leave of 5 to 6 days at the max. But no prolonged bed rest is something that I advise. We make you walk on the same day of procedure. You are walking home the same day, and you can do your normal daily activities. Who are working from home, from the 2nd day onwards, you can continue to work from home. There is no issue. You can start light exercise routine starting from week 2. The first 2 weeks, I advise you to daily walk at least 20 to 30 minutes. Take it easy for the first 2 weeks. But after the 2nd week onwards, start some lightweight exercises in your body. You can just ease into your workout routine, ease into your gym routine from week 3. And after week 4, you can do all high intensity workouts, heavy chest exercises, and get back to your normal gym routine. So let me end this by giving you a few final thoughts about gynecomastia. Don't be afraid. Gynecomastia is a benign condition, a benign overgrowth of gland tissue, and it can be treated. Don't worry, sometimes medical options are also available and medicines can help to shrink this gland tissue. But if this problem is persistent for you, you will have to meet a plastic surgeon and you may need to treat it surgically. Last but not the least, a tailored approach is what I like. A detailed medical history, a detailed thorough evaluation, doing an internal checkup and internal hormonal workup along with evaluating all your medical issues, doing an ultrasound, and with a thorough medical evaluation will come proper pre-surgical planning and execution. If you like this video, do not forget to click the like button below. Do subscribe to our channel, Dr. Karishma Aesthetics. If you would like to reach out to us and meet me in person, visit our website www.kaesthetics.in. Follow our Instagram channel dr.karishmakagodu and do like, share and subscribe.